City volunteers prepare to deliver family medicine packs to Haiti. A City volunteer serves at vaccination station despite her injury. Welcome to the Highlights. I'm Sri Su. Thank you for joining us. In the aftermath of the massive earthquake in Haiti, the residents desperately need help to rebuild their homes and lives. Tzu Chi has initiated relief work. In the United States, City volunteers have packed 6,500 sets of Tzu Chi family medicine packs. These medicine packs will be distributed to affected residents in September. Volunteers will be there as people in Haiti rebuild their lives.
Continue to get these disasters. We can't just be thinking about ourselves. We need to be global. We need to think about how we can help somebody else.
As we do our share, the affected residents' suffering can be alleviated.
We first calm their minds by providing supplies. After they have food to eat, their physical bodies and minds can be stabilized. Then they can start to rebuild their homes.
There are broken pieces everywhere after the earthquake, so children and adults could get injured. Since they do not have shoes, injuries occur frequently. But they do not have medicines at home. The supplies we are providing are much needed.
From sorrows and pain, bless us all with joy and hope. Love and care for each one.
In Malaysia, since July 13, the confirmed COVID cases exceed 10,000 daily. As a result, frontline medical workers have to work for 10 hours a day. To support medical workers, a restaurant owner and city volunteers have delivered vegetarian lunchboxes to them. Let's take a look. To support the frontline medical workers, a restaurant owner and city volunteers have delivered hot vegetarian food to them.
I remember that a dentist has posted a message on Facebook. He asked who knows vegetarian restaurants. Can you deliver the food to us in the hospital? Because he said that many doctors and nurses are vegetarian.
I think the food is also blessed. That's the most important thing. It comes from people who are blessing us, and I think with the food, we can work better.
Very delicious. I feel like it's a home-cooked food.
Since July 13th until now, in Malaysia, the confirmed COVID cases exceed 10,000 daily. As a result, every medical worker has to take care of more than 10 patients and work for 10 hours a day.
Sometimes when we get busy, we might skip a meal or wait till dinner time or later to eat.
So food PPEs you have to wear constantly. You cannot don and then you put back, so it doesn't work. So they're really dependent on the food that can come to them. So at least they can keep themselves, energized, at least for certain hours.
Volunteers have raised funds and taken actions. From Mondays to Fridays, they deliver food to medical workers. A restaurant owner, Emily Chu, has joined a cause to support the medical workers.
They can order takeouts, but you can think about it. After they order takeouts, before the food arrives, they are already on call, ready to start working. They do not have time to eat. We provide convenience to them, so they do not have to worry about finding food to eat.
In the food, there's no garlic or garlic pieces. I use vegetarian ingredients, but the cooking style is Moroccan.
The chef Francis Lau has worked in a 5-star hotel. With 40 years of experience, he's able to cook many different delicious vegetarian food.
In fact, medical workers do not just treat patients with knowledge. They also provide love and care, as the patients' families cannot go inside the walls. So I think we should take care of them. This way, they will have the strength to continue fighting. If you do the work willingly, you won't feel that it is time-consuming.
The restaurant owner and city volunteers have provided vegetarian lunchboxes to show their support for medical workers who will continue to fight against the pandemic. In Kuala Lumpur, Malaysia, a city volunteer Monchek Bong was certified in 2007. From charity visits, recycling to being a documenting volunteer, he's very involved in city activities. Even in the face of the pandemic, he continues to contribute to the community. Let's take a look.
On the way to work, the car suddenly breaks down.
It seems that an electrical system suddenly stopped.
The car that has been used for more than 20 years is not so much a means of transportation as more like an old friend.
I have been bringing aid distribution as well as taking recipients to hospitals with this car. Even those who are paralyzed in a wheelchair all went in this car.
Mak Chekbon, who works in the taxi industry, didn't properly understand Tzu Chi in the past.
In 2002, when I was at a friend's office, the Tzu Chi brother came to share his experience. Previously, I thought that you had to be rich before you could join.
It wasn't until 2007 that actual participation occurred. Later, even in the face of the pandemic, the pace of his effort has not stopped.
Everyone must be afraid. First of all, we must have correct thinking. Secondly, we should take all necessary precautions. If you don't do it, you're just passing time at home. This doesn't make any sense. So in general, I plan very well. In the morning, I'll first deal with the things my mother needs. Then at noon, I'll try my best to take the time to go to the hospital and send lunch to the medical staff. I come back in the afternoon, and if there's need in the community, I'll try my best to cooperate.
Because of his understanding of suffering, he hopes to help more patients. He became a volunteer at Salayang Hospital in 2016 and won the 2020 Best Male Volunteer Award for his years of selfless dedication.
Really a second home to him. He's always, sometimes we are not around, but he's around. he still stays, and he has a job to do. He will get it done.
In his heart, he believes that he gets more than he gives.
What I learned in the hospital before, actually I can use it in my home. I can use this for my mother.
Doing kind acts and practicing filial piety cannot wait, as he is setting a good example for his children.
I think the most important thing I learned from my dad is love for this world. I hope he can take better care of himself. Only by taking better care of himself can he take care of more people.
Putting on Tzu Chi uniform has helped him find the value of life and altruism.
In Malaysia, the COVID vaccination station at Tzu Chi Perak branch has started serving residents in early August. Every day, about 400 residents come here to get vaccinated. Tzu Chi volunteers serve the residents with passion here, making them feel at ease as they receive vaccinations. Every day, about 400 people come here to get vaccinated. Tzu Chi volunteers serve them with passion.
I am grateful that they have set up the vaccination station at the Tzu Chi grounds. They can help more people. By doing this, we can reach herd immunity faster.
It is very good. It is very fast here. I did not expect it to be this fast.
I feel that the process is very smooth because there are volunteers who helped me. From filling out the forms to the end, there are volunteers caring for us at every section.
Even though we are Muslim, also can come here. I hope that everyone can get their vaccine early lah, so that we can have our country back to normal.
On this day, people with high infection risks have also come to the vaccination station. To decrease the risk of infection, medical workers go outdoors to help provide vaccinations. Besides residents who have made appointments, city volunteers also help care recipients to make appointments for vaccinations. This way, they will not be left out.
When I visited them, I asked them if they have been vaccinated. They said no. I feel that they seem very worried, so I help them make appointments to get the vaccination.
A Tzu Chi brother called me and asked me if I have been vaccinated. I said no. Then he told me to come to Tzu Chi to get vaccinated. Tzu Chi volunteers serve us with passion. As there are people who guide us here, we feel more at ease.
At the vaccination station, after the vaccinations for the day end, volunteers will disinfect the place. This way, volunteers and residents can come here on the next day feeling at ease. Since the establishment of the vaccination station at Sanchongjing Sihou in New Taipei City, city volunteers have done their best to support this event. Among the volunteers is city volunteer Jiang Gan. She has been volunteering on site despite a broken toe. Let's meet this dedicated volunteer. I come here every day. I just ignore my foot pain. When I come, I'm rewarded with a good day.
This is Jiang Gan. She has been here at the Sanchongjing Hall each day since it became a vaccination center. She hides her pain and suffering behind her smile and hard work.
The doctor says I have a bone fracture. When I came in the beginning, I was worried about my foot or whether I'd be able to wear shoes, so I used a splint and taped my toe up.
Her right foot is swollen and bruised, to which the doctor has suggested 4 weeks of rest to recover. However, that's not going to keep volunteers away who want to serve.
I didn't think about it too much. They asked me, so I joined. It feels good to be able to help someone else.
Taking care of the public and putting others' needs before their own, Tzu Chi volunteers do their best to support the frontline healthcare workers and safeguard this community.
In Taiwan, after the COVID alert level was lower, the house call team of Hualien City Hospital has visited many cancer patients and a patient suffering from liver problem. They hope that they can encourage the patients to take better care of their health. They also want to comfort the patients' families.
你好。哎，好。皮肤啊，脖子啊，都好了哦。
The medical team has come to care for Mr. Wu, who has just undergone chemotherapy for nasopharyngeal carcinoma.
哦，为什么？哦，吃不下。可是现在看起来皮肤恢复得很好哎。没有味道哦。嗯。
那个要半年。
5%的这种。
5% of the patients who have been treated will feel depressed and cannot come out of it.
一直没办法走出来。
Although he's gradually recovering, he cannot eat. This worries his mother.
He keeps drinking saucy and Coke all day.
整个团队也是讨论了以后，
After the entire team made discussions, we decided to go to his home to encourage him and comfort his mother. You need to improve your nutrient intake so you can recover faster.
好。
那你要加油，我们有约门诊要回来哦。
After that, the medical team delivers nutritional supplements to Mr. Lai, who's waiting for liver transplant.
腿很肿哦，
这 你在工地一定肿了。
因为你一直站着。
Mr. Lai is still working to support his family. The doctor has reminded him to care for his health.
这是鼻肝的药。
对，这是鼻肝的药。
这2天礼拜
Do not go to the construction site for 2 days before Monday.
去工地的了。
赖先生加油呢！
加油加油！
对啊，你看我们团队那么关心你，
可能会咳嗽。
Finally, the medical team has delivered tracheostomy collar made by volunteers for a hypopharyngeal cancer patient. The medical team hopes that by visiting the patients, they'll be able to encourage them to care for their health and therefore recover faster. In Taiwan, it rained the afternoon of this day, but city volunteers did not stop visiting students in need. Students are about to start school. In order to help students to go to school with peace of mind, volunteers brought students laptops. In addition, for the solitary seniors, city volunteers also provided living supplies and festival gift boxes.
Hi， 好久不见啊！好久不见，好久不见。开灯了，开灯了。哦，你那么多东西哦。哎呀，谢谢了，谢谢那么重的，对，真是。奶奶这个是豆浆粉。哦，这个早上泡的这一杯，对。
Volunteers sent Mid-Autumn Festival gifts in advance to enjoy the festive atmosphere. Grandma Zhang has no children. After her husband passed away last September, she has been living alone.
这查到的。对啊，全部都是你吗？不是，这就是2个我。对，这里一个网球，一个锅子，一个团子，对啊。啊，是在家里摆设，然后就看着那个。不是，老师功课。哦，这线上功课教导。对，老师线上功课。
She took the visiting guests to look around. There is no end to sharing things because she is not alone.
就很用心。我们上门说要多用心，你就是多用心。对啊，我们2个同年的。真的。同年。哦。对啊，有80的啦。80就是一个人比较乐观，比较开朗，所以不会老。对，没错。主要就是心情比较要好，笑眯眯的。对，整天，我真的没有冤家。那个我们向人讲啊。
Our master said that you put your 50 years in the bank, so you're only 30 years old.
我们改天再来跟你。打电话来哦。好，改天再跟你聊天。好，我来之前会给你打电话。好的，打电话来。对。好，谢谢了。那么老远的给我送东西过来。有太阳的心情才会感觉。
During the afternoon visit, the volunteers visit several households in several lines.
Here's your brother's computer, and here's a Mid-Autumn Festival gift box. We give it to your family so that all the family can be safe.
The 2 brothers each have a laptop for learning. For low-income families, this is the most surprising gift for the festive season.
开不开心？开心哦！啊，这段时间你们都怎么度过这个线上的这个教学？
用手机。
都用手机哈，用手机看比较比较不方便哈。学校提报过来的时候，我们想。
When the school reported it to us, the school hoped that we can care for their family situations and their financial systems. The father and mother are very polite, hoping to leave this need to those who need it more.
Volunteers stay for a short time because there are still a few families looking forward to the visit of volunteers.
好，再见，拜拜。没有，感恩你们，哈。感恩。
In 1996, Typhoon Herb struck northern Taiwan. In 2001, Typhoon Nari also stayed in Taiwan for 49 hours and 20 minutes. As a result, it caused floods that impacted residents. Although it's hard to predict floods in the past, with the support of technology nowadays, we can accurately predict potential floods in Taiwan. Let's learn more in our feature report.
Due to the greenhouse effect, heavy rainfall becomes a common phenomenon. Along with typhoon season each year, floods are quite normal in Taiwan. But if we can predict flood timings, can we reduce damage upon a disaster? With technology nowadays, what can we achieve with this? Using Shimen Reservoir's 50-year typhoon database, a flood prediction system is built. When data such as typhoon paths and total rainfall are fed into the system, the AI immediately begins calculation.
The typhoon effects normally extend for 1 to 2 days. We'll put our main focus at typhoon path and the rainfall number. All these data will be fed to the reservoir. The workers there can know the peak discharge of flooding, and then when will it hit the peak. Now we can be more prepared.
Through AI analysis, researchers can model the typhoon's pathing through a reservoir. It is now possible to know the rainfall count on reservoirs 2 days beforehand.
Because we're mainly targeting typhoons, so we must collect all of its pathing data from the Central Weather Bureau. As of now, we're aiming at the Shimen Reservoir, therefore we have to collect the influx data. If we have to collect data in the short duration perspective, we have to collect data from the upstream rainfall station.
After 6 years of practical training, a flood prediction system was made, a first in the world. Because before the typhoon arrives, we have to simulate based on a reservoir's data. Firstly, if it's a strong typhoon, we have to lower the water levels. If it's a smaller scaled one, we don't have to lower the water levels beforehand. Discharging the reservoir will impact locals' water usage, and after doing so, the water levels can only be restored through rainfall. If too much is released and too little comes in, the reservoir will lack water. In the past, staff members working at reservoirs will have to evaluate the situation based on experience. Now, through AI simulations, after predicting the discharge amount, workers will know how much water the typhoon will bring into the reservoir.
Because of the typhoon, we'll lower the water levels, especially for preventing floods at the downstream. So when the water levels have been lowered, we can provide data about how much water will be fielding later on.
If we can simulate this line over here, we will be able to know how fast the water is being discharged. So when we are discharging the reservoir, we can discharge fast or slow. If we discharge at a faster rate, but the typhoon brings in little rainfall, this means we haven't predicted the rainfall amount correctly. In the past, after a typhoon passes by, there will be water lacking issues in the country, but now with a flood detection system, workers are able to know the rainfall amount. Reservoir workers will also be able to know when to discharge water, giving more disaster prevention time for staff members. The flood detection system, besides utilizing it in a water reservoir, it can also be utilized at watersheds located upstream. Before a typhoon comes, the system can predict rainfall while suggesting a proper reservoir discharge amount.
During pandemic period, city volunteers continue to promote vegetarianism. In Chile, city volunteers distribute vegetarian food to people in need. Meanwhile, in Canada, volunteers held an online auspicious month prayer ceremony. We'll leave you with these images. Thank you for joining us. Goodbye.